Good morning, everybody. My name is Mary Kuchenbrod. I'm Arcadia's general manager for our core customer business, and I'm joined this morning by Erica Robinson.
Thanks for having me. I'm the Director of Population Health and Performance for WakeMed Key Community Care in Raleigh, North Carolina.
We're going to be talking through some strategies this morning for payer and provider collaboration and value-based care contracts and performance. And our objectives, we're going to explore some of the methods that we use and that have led to success at WakeMed Key Community Care, understand how the underlying data set and decisions based on that data can drive those outcomes, and think through what the opportunities are to align your operations with the results that you're looking to achieve. All right, beyond quality.
All right, so at WKCC, obviously, as with all ACOs, quality is at the forefront of what we do. It's from the beginning, it's always been about the quality measures and really ensuring that the practices are in tune with them, working with the payers to align the quality measures with our performance objectives. And we perform very, very well at WKCC with quality. It's just a very well-oiled machine. If you want to go to the next slide. We are consistently ranked as one of the top, if not the top ACO in the Southeast for quality. Again, it's been something that we have really worked with our practices on. We found that reiteration goes a really long way. And over the past 10, 11 years that WKCC has been around, it's always been something that we're working with the practices on. We're working on best practices. We're pinning practices together to really talk about what works for them on these measures. We have a lot of PDSAs that have floated around. And we even, thanks to Arcadia and the transparency into the data and the payer files, we've really been able to isolate a lot of those CPT2 codes, those wonderful, wonderful F codes that are required for a lot of gap closures. So finding out which practices aren't submitting them, going to those practices, getting them kind of in line, and really relying on EHRs and the Arcadia integration, because prior to Arcadia, it was paper. Everything was paper, paper claims, paper attribution files, paper cuts, everything was paper. So we've really come a long way, and Arcadia has made it possible for us to take our quality even further. And what it has really created is just a strengthening of the payer partnerships. We've just become very comfortable. We have data exchanges set up. Our analytics team do wonderful, wonderful things with data. And they will attest that I'm constantly harassing them for more. And my team is just always wanting more for our practices. And so with being such a well-oiled machine with quality, it was really time to look at what were our other options, because obviously we all know you can only squeeze so much out of quality, and with decreased shared savings for quality payments, it was time for us to look at cost performance and what can we do there and what are our biggest areas of opportunity there. Go to the next slide. And so what we really found was that we had to look at network design. So we are currently a PCP only ACO, but we do have something called a high value specialist collaboration. And it's a very carefully curated collaboration of like-minded specialists in and around Raleigh, North Carolina. All of the specialists, if you want to go to the next slide. All of the specialists have been vetted by our network and credentialing committee. They've had to submit applications on an annual basis. They have to submit quality metrics and cost metrics to really ensure that they are seeing the patient at the right time in the correct setting and really focusing on that quality and focusing on keeping costs down for the patient. And so what we've done over the years is really work on bringing all of those specialists up to where the PCPs are to understand, what is value-based care? What does it look like? What are our goals? And we've also partnered with payers. So obviously we all receive payer files, payer claims, lots of fun payer files. And we've really leveraged those payer files, especially the claims files, to offer the transparency to the specialist. So in 2024, we rolled out something called HVS Enhanced, and these practices that are in this program have the ability to earn shared savings. So we've incentivized them to really hone in on these cost opportunities. And through identifying those, we're really leveraging, one, obviously Arcadia, but two, the payer files and working on those partnerships. And we get wonderful data from all payers except for one, who blinds cost data for us, which is extremely frustrating because they have our largest attributed lives. And so it makes it very cumbersome and it's very hindering. But we've worked with them, we've badgered them over the years. And so fingers crossed, they have told us that they will start unblinding data and giving us cost data for this year or starting this year. And they've taken their own stab at showing cost data for specialists. I will say that they've fallen on their face more times than once. We've allowed them access to the specialists to review the data. And it's just very clear that the payers are just years and years behind where ACOs are with evaluating and leveraging the cost data.
What are some of the things that you can do? What are some of the underlying data aspects that you can leverage to achieve results like WKCC's, to think about how you're leveraging your specialists and how you're interacting with your payers? One of them is really thinking about the construction of your network. If you're going in to play a game, this is all a team sport. At what team do you have playing with you? Do you have the right people? Do you have the right providers in your network? And to make decisions like that, it needs to go beyond just the data you already have from your payers, because that is the data on the providers that are already in your network or who your patients happen to be seeing, to really think strategically about who I should be including in my network. Who do I want to bring into my contracts with payers? You also need the ability to look at outside of your network. And so with Arcadia, we combine your first party data, the claims you get from your payers, with third party data on the entire set of providers in your geography or even beyond your geography, to be able to do apples to apples comparisons and understand, if I bring this 10 or this group of providers in, is that going to be accretive to my performance or not? And make really intelligent decisions, data-driven decisions about the quality performance of providers, whether specialists or primary care, as well as their cost efficiency. What is this going to do to my medical spend? You also need to be able to measure, to both energize and incentivize your providers around metrics that are relevant to the care that they are doing for their patients. And this, especially when you're thinking about a specialist network, can be difficult. Many quality measures are very primary care focused. And so having episodes that are relevant for each specialty, that are risk adjusted in a way that is clinically relevant for that care, not just an overall acuity risk adjustment, allows you to have fair and motivating measurement for providers, including specialists. At Arcadia, we have an episode engine that we can run both on your first party data and on that third party data. So you have that across the board. What is any given provider in my area performing at from a cost efficiency and a quality perspective? And then drill down, if I want to see within my network, let me understand at the patient level what's happening. Let me really explain, if I'm going to put a result in front of a provider that says they're performing a certain way, can I back that up? Can I tell them exactly which patients? Can I drill down and tell them what drove that cost or that quality? And the last is, how do we measure cost efficiency? We really think about having the observed versus expected ratios for cost, but we also think about what are the contract terms that will drive your success. And so with Contract IQ, we model out, if I change different variables in my contract language, if I change different, change this trigger or assume this performance or assume this cost, what will that do to my actual performance at the end of the year? That can let you negotiate between payers and providers with the cards face up on the table, essentially, for what are my strengths, what would happen if we negotiated in this way or this way, and then over the course of the year, how am I actually doing? Where am I actually on track to land by the end of the year? Historically in this industry, this takes a big team of actuaries. And with Contract IQ, this can be done without that. Using your data and using Arcadia's knowledge of value-based care and value-based contracts. Thank you so much for joining us this morning. Hope this was useful. And Erica and I are here to answer any questions that you have.